order to go into cardiology or gastroenterology, you have to start with internal medicine. So you have to do your 3 years of internal medicine training first. It's, you know, one of the basic residencies that you do. After that, if you decide you want to specialize in gastroenterology or cardiology or I'm trying to think, what are the pulmonology, that kind of thing, then you go through a fellowship, and that's anywhere between, I believe, 2 and 5 years, depending on how specialized you want to be. So, you know, your primary courses after medical school are either to do internal medicine or surgery, and then there's some other subspecialty surgeries like ENT, urology, that kind of have their own residency training. So, but the two main ones are going to be internal medicine and surgery. And a lot of people want to specialize, so they do their 3 years of internal medicine, and then they do their specialty in whatever it is they want to choose their specialty in. So, like, for example, cardiology. You don't just straight out of med school say, oh, I want to be a cardiologist, I'm going to go right into a cardiology residency. You don't do that. You do internal medicine first. And during those 3 years of internal medicine, we train in all the different specialties. We don't do any surgery because that's not what we're going to end up doing. But you do some of that in medical school in your 3rd and 4th year of medical school. But yeah, in your residency in internal medicine, we do cardiology, pulmonology, oncology, you know, all those types of things. So that's how you figure out what you might want to do, or you just learn how to do a little bit of those things. So we're kind of a jack of all trades, master of none. Although you end up, in my line of work, you end up being kind of a master of high blood pressure, hypertension, and diabetes. Those are the main things. And then maybe 3rd place would be like maybe a little bit of osteoarthritis. You know, most of my patients end up, you know, once you hit your 60s, you start getting aches and pains everywhere. So I see a lot of that. I treat a lot of that. So, but you get, yes, to answer your question, you get a little bit of everything.
Okay. Yeah.
So a lot of people refer to me as a GP or a general practitioner. There really is no such thing as a general practitioner anymore. And if you ever do go to a doctor that is a general practitioner, you want to go the other direction, because that means that they've only been through their 1st year of post-medical school training, and you get your medical license after your 1st year, your internship year after medical school. So a year after medical school, you go through your internship, you get your medical license, you have your MD after you finish medical school, and technically you can go out and start your own practice if you wanted as a general practitioner. But that's not something you really want to do. Nobody really does that anymore.